Okay, I'd like to introduce our next speaker, Dr. Kat Toups. She is a distinguished fellow of the American Psychiatric Association. She has an upcoming book, Dementia Demystified. She is going to give us a presentation now on functional medicine approaches for reversing dementia. Kat.
Thank you. Okay. Let's get that. I think I need sunglasses up here. Some really bright lights. Hi, everybody. Good morning. I'm here today to talk to you, and I'm going to be talking to you with different hats on my head. I've been an Alzheimer's researcher and clinician, and I have a background in geriatric psychiatry, but I also have a background as a patient with dementia. I also want to note that I might use the terms Alzheimer's and dementia interchangeably. Really, dementia is kind of the umbrella term for a lot of different kinds of syndromes, including Alzheimer's, but just be aware that when we're investigating and in our early detective phases of treating Alzheimer's or other kinds of dementia, it's all a similar protocol. So 10 years ago, when I was 50, I developed dementia. I was running a clinical trials research center. I had been the principal investigator on over 100 clinical trials. I did 20 long-term trials with Alzheimer's and MCI. And I gradually came to realize that I was becoming as cognitively impaired as my patients. I would give them 3 words to remember on the mini mental status exam, and I would forget the words. So I had 2 sets of 3 words that I used, and I couldn't remember which ones. I'd have to write them down so that I could quiz my patients. And the mini mental status wasn't new for me. I had used that test over 20 years, so those were pretty overlearned things that I could no longer remember. I developed visual spatial problems. I had trouble driving a car. I lost the ability completely to back up or parallel park my car. I would try over and over, and I just couldn't deal with the sequencing, and I'd have to go find another parking place. One day my husband got in the car with me, and I was driving, and he said, "Kat, what's wrong with you? You're like a little old lady." And I said, "I don't know. So many things are happening when you're driving." And my processing speed was so poor that I was having trouble integrating all of those things. So, mind you, at the time, I wasn't thinking in terms of processing speed or visual spatial sequencing. I was just trying to function and get through every day. I developed trouble using a computer, and I would ask my husband over and over to show me how to do things on the computer, and he would get mad at me because he'd say, "Well, I just showed you that," and I couldn't even remember that. I would get confused dialing a phone number, and previously I could easily hold 7 numbers in my head and dial the phone number, but I would literally get confused and mixed up and have to dial it a couple of times. And it even got worse. I developed auditory processing problems. I was having such a hard time hearing that I kept going to my ENT and asking him for hearing aids. And he said, "Well, you just have a mild hearing loss. You don't need any hearing aids." But I couldn't understand things. And if my husband was watching TV, I don't watch TV, so I didn't notice this, but if I walked in and he was watching TV, I would ask him if the people were mumbling because I couldn't understand what they said. And one night I had a horrific experience. I was in a restaurant with a couple of friends, and it was quiet. And I suddenly couldn't understand what anyone was saying. I was just getting a snatch of each word. And I was obviously terrified. I went the next day to the ENT, and I said, "I don't care. Just give me those hearing aids." And he looked at me funny, and he said, "You know, this isn't in your ear, it's in your brain." And I had developed auditory processing problems, so I was having trouble decoding what was being said. So in a nutshell, I had developed dementia. My brain was degenerating. But who thinks about dementia in a 50-year-old? I only figured out sort of retrospectively like this was dementia. At the time, I was just trying to survive. So I had developed autoimmune disease, and I was covered with rashes and hives, and I was up all night putting on lotions and steroids, and I had severe fatigue. I could barely get out of a chair for a year, and if I could get out of my chair and go into a store, the smells would give me more rashes and hives and brain fog. There were multiple other things that I learned and worked through in my healing path, but I've treated enough patients with dementia to know that when you get dementia in your 50s, it's very different than late onset, and people that get it early progress very rapidly. So if I hadn't have discovered functional medicine, I feel like I'd be drooling in a nursing home by now, and maybe not here. So I'd like to tell you a little bit about what I learned to reverse dementia. Now I've been working with dementia patients for quite a while, and so give some ideas of some of the factors that we work with. So I mentioned functional medicine. I think most of you are probably familiar with functional medicine. In functional medicine, we want to know why. We don't want to just know the name of the disease and the medication, but really we want to know the underlying root causes of the illness. Why do you have it? What caused it? And what factors are perpetuating that? So that's some of the ways that we're working on dementia, is to look at those same kind of things. So first I'd like to make a point that Alzheimer's is a neurodegenerative disorder, but I don't think that it's a mysterious, untreatable brain disease that just happens. It's a potentially reversible multi-system illness. It occurs due to toxins and infections and inflammation and lack of hormones and nutrients and other diet and lifestyle factors, and there is a strong autoimmune component as well. So there are, as I said, neurodegeneration doesn't just happen. It happens for reasons, and so what we want to do is search out and find all of those reasons, and then we have treatment targets, and we have ways to halt the dementia and hopefully to reverse it. So Alzheimer's and all dementias are multifactorial diseases. They're very rarely due to just one thing. And so we have to work hard to figure out all of the factors, and I'm going to take you through some of these today. There may be the proverbial straw that breaks a camel's back, where suddenly somebody realizes that their loved one has dementia. They might have surgery, and we know that general anesthesia is a risk factor for dementia, or they may have an accident. But it's been a process of things developing over time that lead to the development of dementia. So some of the contributing factors, metabolic, like high lipids, high blood sugar, blood pressure, obesity, nutritional, toxic, inflammatory, infectious, autoimmune, chronic stress, head trauma, and or withdrawal of trophic support like hormones and key nutrients. Now, if we can find and remove the underlying causes of dementia, then we can call on neuroplasticity to help regenerate and revive our brains. And that's a whole lecture in and of itself. But, there's a lot of fascinating work that's been done in this. Norman Deutsch, Barbara Arrowsmith-Young, Annie Hopper with DNRS, and other people that are teaching us ways that we can rewire our brain. When I was in medical school in the 80s, we were taught that by 18, we had all the neurons we were going to have, and it was just going to be downhill from there, right? I know a lot of you remember that. But now we know that you can make new synaptic connections in your brain up until the time of death, even in old age. People have literally put people in scanners and looked at that. So like I said, it's a whole other topic, but the part of what we do is, try to remove causes and then call on neuroplasticity to help things. So there's a lot of books and methods and things that are, coming out about treating dementia, and people are talking about changing the diet, taking supplements to reverse the nutritional deficiencies, enhance the mitochondrial function, exercise and meditation or mindfulness practices. Those are the two best validated things we have to change our brain. They increase the BDNF, or brain-derived neurotrophic factor production, that helps us make new synapses in our brain. Getting good sleep so our brains can detoxify. We know know now that we have this amazing lymphatic system in our brain that is activated when we sleep, and it's the washing machine for our brain, and it cleans out the day's toxins. So if we're getting by on 6 hours a night sleep, we're chronically losing out on our brain detox. So those are all things, that are absolutely essential for that I work with my patients on all of these things. And diet and lifestyle changes are exactly where you need to start, not only for dementia, but for any kind of chronic disease and for general health. So I've seen some patients make rapid gains in their health by throwing out their processed foods and changing to eating real foods, that it's organic, free from toxins, nutrient dense, rather than filling up on sugar and carbs. Because of the frequent immune problems that I find with neurodegeneration, I like my patients to eat anti-inflammatory diets that are at a minimum free of gluten, since that turns out to be the most inflammatory food that we eat. Personally, I prefer to see my patients eliminate all grains, since they all have a very high glycemic index, and we've long known that high blood sugar is a huge driver for dementia. Now we have an increasing body of research showing the benefits of a ketogenic state on the brain and cognitive function. So this turns out to be another useful modality in working with dementia. We know that early man engaged in intermittent fasting. They would, maybe kill a big prey and have something to eat for a few days, but maybe they didn't get to eat for a few days if they didn't kill anything. And so this is one of the reasons that we're adapted to ketosis. Basically, our body uses either glucose or ketones for fuel. And if you deprive the body of glucose and the carbs and sugars turn right into glucose, then it will shift into burning fat for fuel. And that's what ketosis is. So we've long known the benefits of ketosis for children with intractable seizures. Since probably the 1920s, they started using ketosis for kids that didn't respond to seizure medications. And the statistics on that are quite dramatic. Something like 2/3 of the children can either completely resolve their seizures or greatly diminish them. So we have clear evidence that the ketogenic state is changing the electrical activity and firing in the brain. And also, many people in ketosis say they have increased energy and they report heightened brain clarity. And some people that are having cognitive problems feel like it's helpful for their memory. So we do find it worthwhile to try a ketogenic diet in patients with dementia, as some will have dramatic improvement. That's not going to remove the causes, but it's going to definitely help their functioning on a day-to-day basis. There's one caveat. We like to keep an eye on the lipid levels in the patients with the ApoE4 genetics. So the ApoE4 allele is called the fat bucket gene, and people that have ApoE4 have a tendency to store all of their lipids as fat. And so these are people that, some of your patients that they're doing everything right and they have really high lipids. A lot of times it's that genetic proclivity with the ApoE4. So some people are worried that if we're feeding a high-fat diet, we're going to elevate the lipids. And so what I usually do is I check their advanced lipids before we start, and then I'll check them again after 3 or 4 months. And occasionally I'll see people that do have their lipids go up, and it's maybe not the right diet for them. And other patients, even I see them go down. So it can go both ways. There's various reasons ketosis isn't for everyone, and I think we'll have some more information on a later talk about that. And then while I'm on diet, I wanted to mention intermittent fasting. So intermittent fasting, there's been so much data on fasting, and we know the less calories we eat, the longer we live, and we have all the research coming out in so many realms. But what we ask our patients to do is to do intermittent fasting every day. Just restrict their caloric intake to ideally 8 to 10 hours of the day. Some people need to go to 12, but if you don't eat anything for 12 to 16 hours of the day, unless you have high blood sugar, you're going to start shifting into a ketotic type state. And the fasting, so as I mentioned, it increases longevity, but it also decreases inflammation and increases autophagy, and we know that all of this is helpful for brain health. So I just want to make this a point again and again. Dementia is both treatable and preventable when we can find the underlying causes. People need to know that dementia is not a death sentence. So let's look at some of the factors here. I know we got a lot of good information in the last lecture, but we've long known that certain nutrient deficiencies can lead to or increase the risk of dementia. And these are easy to test and they're easy to fix. So you can see some of the things here, the B vitamins, vitamin D, C, E, mag, zinc, copper, iron, fish oil, and CoQ10. The CoQ10 is essential for mitochondrial support, and one of the final steps of the electron transport chain to make ATP requires CoQ10. And we know that amyloid, which is secreted with dementia, inhibits the electron transport chain in the mitochondria. So mitochondrial support is especially essential with Alzheimer's or any type of neurodegenerative disease. B12 and folate both reduce the homocysteine levels, and we know that homocysteine, we know now that that is an independent risk factor, elevated homocysteine for dementia. So that's something to really keep an eye on and work aggressively to lower the homocysteine. And then we've long known that B12 deficiency causes deterioration of the brain, the spinal cord, the peripheral nerves, in up to 40% of people that have low levels. So I don't want to see my patient's B12 level like just at 400. You don't want to barely be in the bottom of the range with these nutrients. I like to get people at least into the middle of the range with things. B1, thiamine, long associated with irreversible brain damage, which we see with alcoholism. B3 helps transport oxygen and supports the mitochondrial production. Vitamin D is especially important. It's really a neuroactive hormone. It has receptors in multiple regions of the brain, including the neurons, the glial cells, the macrophages, and also in the spinal cord and the peripheral nervous system. So vitamin D can actually stimulate the clearance of amyloid by the macrophages, and it protects these immune cells from apoptosis. It's involved in glutathione metabolism. It has direct antioxidant effects and many other functions. So this is such an important vitamin/hormone for everyone. There was a 2018 paper that used data from 2012, and they reported that 40% of Americans were deficient in vitamin D, including our children. Vitamin D deficiency is generally defined as a level less than 30, and they said that was 25 million people in the U.S. Deficient in vitamin D. Now, studies have shown that people with low levels of vitamin D actually have significantly faster declines in their memory and general cognitive function with aging. And if your vitamin D level is less than 30, it increases your risk of Alzheimer's by 53%. If your vitamin D level is less than 20, it increases your risk by 125%. And I see lots of people. I live in the San Francisco Bay Area. It's too far north to extract enough vitamin D. We evolved to extract vitamin D at the equator. So people say, well, I'm in the sun a lot. Check those vitamin D levels. It's far too critical. I like to get the vitamin D level between 50 and 80. Vitamin E and vitamin C are interesting. They seem to work synergistically to reduce the oxidative stress that's happening with dementia and neurodegeneration. So the combined use of these two vitamins seem to reduce the risk of Alzheimer's in studies better than either one alone. Magnesium regulates a receptor in the brain that plays an important role in memory and learning. So low levels of magnesium have also been linked to inflammation, which is another important dementia risk. A 2017 paper from the Netherlands with 10,000 people showed that both people in the highest levels of magnesium and the lowest levels of magnesium had a 30% risk of increased risk of Alzheimer's. So there is a sweet spot there. And I think, it's just become so easy to monitor all of these nutrient levels through our traditional labs. So it's worth looking at. Zinc is another one, super important mineral for human metabolism. It helps to metabolize our food, repair our DNA. It helps with normal growth and development, membrane integrity, antioxidant defenses, immunity. It's very important for the immune system, appetite maintenance, night vision. Iron in the central nervous system is required as a cofactor for oxidative phosphorylation, for neurotransmitter production, nitric oxide production, and oxygen transport. And copper is another important one. It's the essential cofactor for neurotransmitter synthesis, but it's also important for neuroprotection. It's involved with the superoxide dismutase enzyme that helps us to detoxify. And as you'll see from some of the stuff I talk about, development of toxins is one of the things that's triggering the amyloid production. So high copper levels, copper is another one with a sweet point. High copper levels can cause an increase in amyloid aggregation, and they've actually found high levels of copper in the amyloid plaques when they've done autopsies in people with Alzheimer's. And too high a copper causes oxidative stress. So it's another one, not too high, not too low. And finally, the omega-3s and the fish oil, the dietary fats, are also very critical for the brain. They get incorporated into the cell membranes of the neurons, and they also help the whole structure of our brain. Our brain is like 60% fat. Think of it, it's that spongy stuff. And then we have the myelin sheaths around the nerves, and that is also made of fat. Cholesterol is just so critical for the brain. And if we don't have enough cholesterol and healthy fats, then the brain is going to suffer. That was interestingly one of the factors that turned up in my own personal case. My cholesterol was always 130 to 135. I ate a low-fat diet. That's what we were taught was healthy. And now they say that's the biggest medical mistake of the last century. And one of the ways that I got my brain more functional was I completely changed my diet and put in high fat at every meal and got my cholesterol up over 200. There's nice data that shows that the optimal cholesterol level or for the lowest all-cause mortality is between 200 and 240. And so we see a lot of also psychiatric impairment when the cholesterol levels are too low. Okay. Mitochondrial nutrients, as I mentioned, with any degenerative disease, the mitochondria are under siege, so supporting the mitochondria are helpful, and those are some of the nutrients I like to use: CoQ10, acetyl-L-carnitine, NAC, glutathione, one or the other or both, and then R-lipoic acid. Let's see. And then I think that I want to say a little bit about BDNF, or brain-derived neurotrophic factor, and exercise. So that is really increased with exercise, and I think exercise is one of the most important things we can do on a daily basis to protect our brains. And they just discovered recently another hormone that's secreted with exercise called irisin, and that also promotes development of neurons, particularly in the hippocampus, where our memory center and one of the main areas of degeneration when you have Alzheimer's. So those are some of the basic stuff, but I'd like to now use the rest of my time to talk about some of the things that I think people are missing. And then people are following all the diet and the exercise and the brain training, but they're not getting better. And so this comes to the investigation and the discovery. And the things that I really want to have people know more about are the toxins, the infections, and the lack of hormones. So they all go hand in hand, and they all protect the brain. Let's see. Before I get into specifics, I was just going to say a little bit about the amyloid hypothesis. And Alzheimer's is thought to be due to amyloid deposition in the brain, and also the development of neurofibrillary tau beta tangles. And all of the pharmaceutical trials that have been happening in the last, 15 years have been directed toward removing these amyloid plaques from the brain. And I participated in all of the clinical trials for the current medications on the market, and those drugs can maybe slow down the process for a year, and they might even hasten the process because they're blocking some of the neurotransmitter production, and with some of the feedback loops, it could make things worse. But I also participated in many clinical trials that failed, and some of those trials were to remove the amyloid, and there are drugs to remove amyloid from the brain. We were able to show that using the PET scans, but it did not translate to clinical improvement. And Oh, sorry, I think that slide went with that. The problem is amyloid's not the cause of dementia. It's a downstream effect. And so we need to look upstream. We need to look at these upstream causes like the toxins, infections, lack of hormones, nutrients, things like that in order to stop the amyloid deposition in the first place. Amyloid is a sticky, gooey substance, and it gets secreted when there's any kind of insult or injury to the brain. So any kind of provocation, the brain will make the amyloid to wall off the wound just like we get a scab when we're bleeding. And so a little protection like that, okay, is a good thing, but if you're having chronic toxic attacks and you make more and more amyloid, then it ends up gumming up the works and the brain doesn't work. I don't want to say much about the genetics, but it's important to know that with certain genes, you will have a more exuberant amyloid response. And ApoE4 is known to be a higher risk factor for developing Alzheimer's, presenilin-1, and the amyloid precursor protein as well. And so if you have these genes and you have an insult, you're going to secrete a lot more amyloid than someone that's an ApoE2 or an ApoE3. The ApoE4 is known to be a pro-inflammatory gene, and it actually dates back to early Homo sapiens when we first separated from primates and came down out of the trees. That's when the ApoE4 came onto the scene. And it's a pro-inflammatory gene. It actually promotes inflammation, and that was useful and therapeutic at that time when man came down out of the trees. He had a risk of predators and rocks and sticks and injuries. So that helped to promote healing. Inflammation in the short term helps us to heal from injuries, but the problem arises in inflammation in the long term, and lots of inflammation then can damage the blood vessels, the organs, lead to chronic illnesses, heart disease, diabetes, hypertension, and dementia. And this wasn't a significant problem for early man because we didn't live very long back then. Until the 1800s, the average life expectancy was 35 to 40 years. But now our life expectancy is 75 years, and many people are living 10 or 15 years past that. So it's a lot of time for the high levels of inflammation to wreak havoc with our bodies and our brains unless we take steps to prevent it. So finding out that you have the ApoE4 allele, I think, is helpful to know because I think it can help motivate people to take more steps to reduce and minimize their inflammation. Okay, so let's then look some more about some of the things then that are causing the amyloid. I just, of course, want to say that genes don't equal destiny. We all are learning more and more about epigenetics, and so things like our diet and lifestyle and infections can turn on genes or not turn on genes. So again, let's go back to the toxins, infections, and lack of hormones. And I'll start with the hormones since that's kind of the easiest, and I know a lot of you are experts in this area. The brain is full of hormone receptors. So we have all of these receptors in our brain: estrogen, progesterone, testosterone, pregnenolone, DHEA, BDNF, thyroid hormones, vitamin D, and vitamin B12. And I include the vitamin D and B12 because they're really hormones, because they bind to receptors in target organs and tissues, and they exert changes in gene transcription. So all of these hormones occur in both men and women, and they have other functions beyond reproduction, like neuroprotective effects on our brain and our nervous system. They're all neurosteroids, and they can all exert beneficial cognition effects for the brain. Okay, estrogen it's immensely important in our brains. It helps to shuttle glucose to the brain, so low estrogen can result in low glucose utilization in critical brain areas, and our brain does need a lot of fuel. The brain and the heart need the most fuel. Estrogen's known to bind receptors and exert effects in the prefrontal cortex, the hippocampus, the basal forebrain, and the striatum. And it's also been found to be essential for consolidation of memories. About 5 years ago, it was discovered that the hypothalamus can actually produce large amounts of estradiol and control and participate in the control of the gonadotropin-releasing hormone neurons. So the estrogen is so important that the brain is making its own supply. Even after the ovaries stop producing, the brain should still be making estrogen. So if you're healthy and there's nothing messing with your brain, then you'll keep making those hormones. But unfortunately, our world is just becoming increasingly toxic, and the levels of infections that we're seeing because of the toxins in our world are disrupting things like that. So progesterone is also secreted by the brain. Both of those things were news to me this year, doing some research in that. And it's also secreted by neural cells. It affects the myelin production, and it acts like a signaling neurotransmitter. So progesterone can protect the brain from damage by promoting growth and repair of the myelin sheath after an injury. And that protects the vulnerable nerve fibers. And there's been studies show that giving high-dose progesterone injections for a few days immediately after a traumatic brain injury or stroke results in a significant decrease in mortality, and the patients had better cognitive recovery compared to the placebo controls. It's also long been known that progesterone converts to allopregnanolone, and that binds to the GABA receptors, so it's very beneficial for sleep and anxiety as well as memory. So there's data for all of those hormones that I showed you. They're all trophic for the brain, meaning they give life to the brain, and then they help the brain to recover after injuries. And if we don't have enough of them, the brain can start to degenerate. I had an amazing case, but I've seen more than one person with iatrogenic dementia from long-term finasteride or Propecia that's given for prostate enlargement, and some people take it for hair loss. So the finasteride blocks the conversion of pregnenolone to allopregnanolone, and then it also blocks the conversion of testosterone to DHT, which is our most potent testosterone hormone. And blocking these hormones that are vitally important for cognition and neuroprotection can result in neurodegeneration. The same thing happens to women with surgical menopause or natural menopause. The longer a woman's brain is without these protective and trophic hormones, the more neurodegeneration she might experience, with the result being a decline in cognition and one more risk factor for dementia. So remember, it's multiple factors all coming together. Dr. Natalie Razgon at Stanford did a study a few years ago, and they randomized postmenopausal women who were on hormone replacement and had a high risk for Alzheimer's to either stay on their hormone replacement or stop it. And they followed them for 2 years. They did PET scans looking at the metabolism and cognitive testing. And what they found at the end of 2 years, the women who continued their hormone replacement, and this was a combination of, the old synthetic hormones and bioidentical, it didn't matter what kind, the ones who stayed on the hormones had preservation of their frontal and cortical metabolism, and the women who were randomized to stop the hormones all experienced a decline. So that was pretty telling. Come on. There we go. Okay. So I have many studies in my files with evidence of the trophic nature of these hormones for the brain and cognition, and they're also helpful for healing from TBI and stroke. So for the purposes of preventing further decline and helping brain repair when people are suffering from MCI or early dementia, it's easy to test all these hormones. It's easy to help people replace them. I shoot for the midpoint of the therapeutic range for most of them. And let's see, I think, that slide. Well, we're actually putting people on hormones for, like women that have been off for 15 or 20 years, and there had been some teaching in the past that might be harmful and make things worse, but it turns out not to be the case. Okay. infections. So anything that affects the brain can disrupt the production of all of these hormones in the HPA axis. And in particular, I'm frequently finding people of all ages with neuropsychiatric Lyme disease that is wreaking havoc on their hormones, as well as other things like reactivated Epstein-Barr and mycotoxins from toxic mold exposures. They're all disrupting the HPA axis. I've had to treat even young men in their 20s and 30s with testosterone, and it gets whacked out by these infections. So the young people, when we remove all those provocations that are affecting their HPA axis, they actually can recover. I can see their thyroid recover, their hormone levels recover, but they often need to be continued indefinitely in older populations. So, as mentioned, the HPA axis can be disrupted by head trauma, lack of trophic hormones, chemical toxins, and the infections. There's many types of infections that affect the brain and cognition. I have a 2-page long list of infections that I've discovered that can affect the brain. Syphilis has long been known to cause dementia, and it's always part of a dementia workup, and it still needs to be included in a dementia workup because it has been increasing in prevalence lately, but these days the Lyme disease is something, as I mentioned, that's wreaking a lot of havoc. So syphilis and Lyme disease are both caused by spirochetes, and just like syphilis, the Lyme can start elsewhere, but it has a predilection for brain tissue. So it can migrate to the brain and grow slowly over time until many years down the road the patient may manifest cognitive problems as more and more of the brain tissue is destroyed. And anytime there's an infection in our brain, our immune system should become activated. And when the immune system is activated, it causes inflammation. And as I mentioned earlier, the inflammation wreaks havoc because it secretes all these inflammatory cytokines to destroy the invaders, but it can destroy the neurons and the brain tissue as well. So it's my little acronym for myself, ICUBE, things to think of that I want to always be thinking about with patients with cognitive decline: inflammation, infections, and immune activation. So once the immune system's activated, it can just stay chronically stuck on in that position if the infection hasn't been eradicated. We know from the work of Dr. Ari Vajani at Cyrex Labs that there's multiple triggers that activate the immune system and cross-react with amyloid. Certain foods will travel through a leaky gut and get absorbed in the bloodstream and cross the blood-brain barrier, as well as certain metals and certain infections. So there are certain things that cross-react and will cause a lot more amyloid production. So for many of our patients that are having these infections and having immune activation, we'll use low-dose naltrexone to help quiet down the immune system. I'm going to start racing the clock here. Inflammation. We had a signal in the early days, in the early 90s when I first started working with dementia, some signal that anti-inflammatory drugs might be helpful, but they didn't really pan out. But now the pharmaceutical industry is looking again at anti-inflammatory drugs for dementia. The problem is no single drug is going to fix dementia because it's happening from multiple factors. If you don't get a lid on all of the factors, you're just going to be like a hamster running on a wheel, and you're not going to get there. Lyme is a particularly tricky organism to treat. It takes on one of 3 different forms, and the different forms are designed to escape detection from our immune system. It's notoriously hard to diagnose. It often causes immunosuppression. So when we're testing a Lyme Western blot, we're looking at a B-cell antibody response, and some people just, because it's suppressing their immune system, they just don't make those B cells, so they could have Lyme and they won't be picked up on a Western blot. And then to add to that, the Western blot testing done at Quest and LabCorp has thrown out the bands that were part of the now defunct Lyme vaccine. There used to be a vaccine, and it would cause development of antibodies to some of the factors that can be looked at on a Western blot. Now, I have not personally come across anybody that had that vaccine, but Quest and LabCorp still are not testing those bands. So These days we're finding other ways to test it. We're looking at testing with a T-cell response, and some people are using PCR testing, and people are trying to develop testing that looks at multiple strains because there's so many strains of Lyme and co-infections, and the testing may test for one or two strains and not the one that you have. There's a T-cell ELISpot testing out of Germany that's been especially helpful. So it detects T lymphocytes that get activated during an infection, and it's reportedly 20 to 200 times more sensitive than the ELISA testing. So when you get an infection, the T cells will respond in 1 or 2 days, and so that kind of testing can be helpful early on, because with the ELISA and the Western blot testing, you have to wait for the body to produce antibodies for that testing to turn positive, and that can take 3 to 6 weeks if you're going to make the antibodies at all. So the T-cell testing has been really helpful, and it's also been helpful for us to know when has somebody cleared an infection. Some people are treated for Lyme forever and ever, and maybe it's gone, and I've found that in a lot of my patients that they have cleared it by looking at this T-cell response. Some people use PCR testing. I don't think it's quite ready for prime time yet. It tells us if you've been exposed, but some of my colleagues do find that helpful. I use a lab for Western blot testing that tests all of the bands and not just they don't throw out the ones from the vaccine. But I know there's companies working on better ways for testing, so stay tuned for that. These are some of the infections that I turn up in people that are linked to cognitive decline. The Lyme and the tick-borne co-infections, the Epstein-Barr, reactivated Epstein-Barr has been a huge thing that we're seeing a lot of. The herpes simplex 1 and 2 and 6 and 7 and toxoplasmosis, mycoplasma, and then, as always, we need to rule out syphilis, HIV, and hepatitis. These things have long been known to injure the brain. So these are my first pass tests, and I will do these and some more, depending on what turns up. There were 2 papers published in 2018 in Neuron, and they implicated the herpes viruses HHV6A, HHV7, and HS1 in the development of Alzheimer's. So we've known about the connection between HSV1 and dementia for at least 15 years now. HHV6A in particular was found to be a key viral modulator in Alzheimer's, but unfortunately you can only test for the A subunit at some research labs, so it's not commercially available yet. All of these viruses will accelerate the beta amyloid deposition and induce the tau fibrillation, and progression of Alzheimer's correlates with increased levels of these viruses. There was a third paper in 2018 that looked at huge number of patients, and they showed that when they were treated with antiviral medications at any time in their life, that their dementia was reduced by a factor of 10. So some of us are now actually recommending starting antiviral medicines like acyclovir, valcyclovir for a period of time when we're finding high levels of these viruses in our cognitive patients. And we understand that Stanford is doing a trial right now, and they're keeping their patients on for I think it was a year and a half. It was a long time, so we don't really know, but it's something to think about. Mycotoxins from mold are another serious threat to the brains of susceptible people. There are certain kinds of molds that are toxic to everyone, but some people seem to be more sensitive than others. And if you get out of the mold, people who aren't particularly sensitive will clear the problem, but a subset of people don't detoxify well. They have trouble clearing the mycotoxins, and they continue to circulate in the body and trigger an immune response. And the mycotoxins often are inhaled. They travel easily through the porous cribriform plate into the brain, and they wreak havoc on the brain. I think we'll be hearing some more about that in a subsequent lecture, but I think the most important thing is to first try to get people out of the moldy environment and remediate the space. I have had patients that were so demented from mold that they couldn't speak, that they couldn't get dressed, they couldn't feed themselves, and when they got out of the moldy environment and had treatment, it was amazing how fast their brains could reconstitute. So this is something that just can't be overlooked. Chemical toxins and heavy metals disrupt the brain HPA axis. We've long known those things. They increase they activate the immune system, they cause cancer, they disrupt the hormones, they cause neurodegeneration. Our world has just become so toxic. We know that infants these days are born with over 200 chemicals in from the cord blood of the mother, from products that the mother's using and getting exposed to. So it's a huge problem with our brain. These are some of the this is one of the main tests that we have commercially available for testing the toxins in the urine and also looking at the Roundup levels. For the toxic metals, we're just testing whole blood these days through Quest and LabCorp. The provoked urine testing that's been done, there's no standards for the levels, and in Oregon they recently made it illegal to use that to make a diagnosis. So you can just order metals testing from the whole blood at Quest and LabCorp. I'm going to just show you one thing really quickly. This is one of my patients who had just some minor cardiovascular and lack of hormones, but she was quite demented. She was already in memory care. And this is her testing. This is what the tox test looks like. It's several pages long. But if you have one thing in the red or two things in the yellow, it's considered significant. But check this out. This lady had 9 things in the red. So she was just a terrible detoxifier. She was a school teacher. Her daughter told me they always were healthy and didn't use chemicals in their home, but she did not detoxify well, and I think that was a factor for her dementia. I'm just going to whiz through things real fast because I'm out of time and I'm over time. To detoxify chemicals, sauna and sweating is one of the best things. And here's my basic dementia protocol in a nutshell. And you can just read that and look at all of those factors that are contributory. There's a slide on the lab testing and a lot of the specialty testing that I do. Some promising mitochondrial rejuvenation treatments, H-spot photobiomodulation, IVNAD, stem cells, and then I have a bunch of slides here in the resources for people that would like to know more. And I'd like to leave you with dementia is not a death sentence. There are so many options for treatment, and so I think if people learn to investigate all these, we'll make more traction in helping our patients. Thank you so much. Thank you. Thank you.